Yeah. I just want people to get beyond even though we suck less than the other person.
Preach it.
Oh my
Hallelujah.
gosh.
I've actually had people say, well, we know we're better than the other guys.
Okay.
The criminals don't care.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to episode 382 of the Help Me with HIPAA podcast. My name is Irrelevant, and Donna Grindle is our host of the day.
Well, hey, Irrelevant, how you doing?
Shout out to Eric Decker.
We'll just leave it at that.
Leave it at that. Yeah.
Till he's on the podcast the next time.
Yeah. Then I'll get him. All right. So today we were talking about some cybersecurity is patient safety. Now, not that we've ever talked about that.
No, never.
Not that that's almost like our moniker, but there was, what do you want to call this? A report?
Yeah. There's an official name that, there's always official stuff, but it's, comes from Warner's office. Mark Warner from West Virginia has been a huge healthcare cybersecurity supporter. And this is
Commonwealth of Virginia, right?
Oh, is it? I thought it was West Virginia. It's Virginia. It's there in that area.
It's Southern Virginia.
I am tired. I'm just tired.
Mm-hmm.
But anyway, it's a policy discussion paper where they've identified areas and said, we're going to publish all this information about these specific areas in healthcare that deal with cybersecurity and the needs of the industry or the sector, because we are critical infrastructure sector that everybody seems to be worried about, as they should be. And if anything, the last couple of years have made it aware. What we've been saying, we aren't lying about the needs in the sector and how complicated it is and how broad and so on and so forth. But anyway, this paper is out there to create a discussion, and we're going to review some of it, but we want other people to go do it too. So we'll give you links.
Yeah. So we are going to discuss some of it today. But before we do, we want to remind everybody that the Privacy and Security Bootcamp is quickly approaching. It's March 12, 13, 14, and 15 of 2023.
And based on some of the traffic we're getting, there is limited seating. We can only put so many people in that room.
Yep. So I was talking to somebody today, and they said, I'm thinking about going to the Privacy Bootcamp. I'm like, okay, why are you only thinking about it?
Right.
And then I said, you do realize that we're having a bourbon and breeches session, right? And they're like, I'm in.
Yeah, it's going to be the best part, I'm sure. But I got to work on that. Haven't had time, but I will come up with breach stories to pair with a bourbon tasting. And don't worry, we'll have everybody covered if you don't drink the brown water. But you can go to
PriceSecBootcamp.com to learn more.
You can learn everything there. You can sign up there. You get your link to book a room there. Everything you need, all in that spot, except, of course, for us. We will not be on the website live.
That's right. All right. I want to thank all of our donors and people who help keep this show on the air. Appreciate it.
Yeah.
So,
pass it along, do the reviews, all that kind of stuff. Your job. We're doing ours.
That's right. We only ask one thing. Just leave a review. So we're going to skip the HIPAA Say What segment for this week because we have a lot to talk about. And 4 or 5D tip of the week. So Donna, do you want to talk about, maybe maybe you don't want to talk about? Is this like Fight Club? So,
no, I just
Donna-
got back from the big all hands meeting for the Health Sector Coordinating Council Cybersecurity Work Group. All of the task groups, and 405D is one of them.
Yeah. So you got to rub elbows with a lot of the folks that we've been doing a lot of work with.
Yeah, it was great and a lot of fun. I tell you, I was exhausted. The amount of thought and conversation and debate that is absolutely essential for the sector. And I was exhausted from that, but so excited about what we're doing. And there's so much that, I mean, like, anytime now we are going to start rolling out stuff, but you have to get all of the things in the row. This has to come before this, which has to come before this, which, so right now we're waiting on HIPAA 2022 to get the final signature it needs. And then that'll trigger all kinds of things to happen. So as soon as that happens, we're going to have a lot to share and a lot to discuss. So yes, I'm very excited.
Sweet. I'm excited.
You missed a lot, David, and we made fun of you a lot. Oh, wait, I made fun of you a lot.
I'm sure you did. I'm absolutely sure of it.
I volunteered for you on everything that came up. I said, David will be happy to do that.
That sounds like exactly something you do. No doubt about it. So
He's a volunteer.
Yeah, I hate I missed all that, but I've got a grandkid due any day now.
TikTok.
So, yeah, I know. And we did make it through the weekend with nothing, but that I was told that if it don't happen Friday, we're making it happen. So,
ooh,
yeah, lots
your first
going on.
Granddaughter.
Yep, my grandson's first birthday is this Saturday, so we're going to have both my grandkids within probably a week of each other.
Yeah, and you be the big old sucker.
Yep. So, as
You've
always,
you didn't have daughters.
No, did not.
So I can't wait to see what happens when a little girl wraps you around the finger. All right.
Yeah, we'll see. All right, let's get into some cybersecurity as patient safety and talk about this. There's some policy options that are out there.
Mm-hmm. It's and so this paper is really, really interesting. There's a ton of stuff in it. I highly recommend you come get the link to go check it out. It is the official title anyway that is done by, it's the staff at Warner's office has been very involved and all good people. And I hate that I missed when they came by to talk to everybody last week, but it was added. But it's from the office of Senator Mark R. Warren. Cybersecurity as patient safety policy options in the healthcare sector. And officially, just released when we are recording this anyway. You may be listening to it years from now, but we just learned that. But the good news is there is a lot of information that you could learn from, you could help plan with, and you definitely could offer some input, which is definitely needed throughout the entire sector. So, because we're such a large sector, getting more information, it is absolutely key.
Mm-hmm.
So, that being said, we'll do what is this quick overview of what the paper says and the reason that it exists. And I highlighted a section. Senator Warner wrote, unfortunately, the healthcare sector is uniquely vulnerable to cyber attacks, and the transition to better cybersecurity has been painfully slow and inadequate. Preach it, brother. The federal government and the health sector must find a balanced approach to meet the dire threats as partners with shared responsibilities. So I think that is a fair statement.
Mm-hmm.
I am not going to claim that it's not. But the paper is divided into 3 parts. So you got chapter 1 that talks about the government and things like what we're doing with 405D and 7 key challenges and who has jurisdiction and all this other kind of stuff. So there's a big chunk of details of the current state of play regarding threats and policy options for shoring up existing vulnerabilities. That's chapter 1. As if that wouldn't be a whole book by itself.
Yeah, no kidding.
Chapter 2 is ways the government can help the private sector meet the threat through a combination of potential mandates and voluntary incentives to adopt best practices.
We're the government. We're here to help.
Well, everybody keeps going. Why are you making me pay for this? You should give it to me for free. You can't have it both ways. You know what I'm saying?
I know.
So, but there's some interesting ways that they're looking at, and we're going to cover a couple of those discussions that they are looking at to do these incentives. And there's some very specific reasons that they're looking for incentives. It gets back to that painfully slow thing.
Mm-hmm.
It's like, McFly. And then chapter 3 covers policies that could help in responding to attacks in the event of a cybersecurity failure. And it notes ways institutions can recover following successful attacks and how to limit the impact on patients. So they just went right off the bat, boom. We're going to tell you this ain't looking good. It ain't pretty.
Mm-mm.
So... And now I've lost my place, but I did have a snippet. If you see it, David, get started. Yep. Oh, you just lit it up. Go ahead.
The healthcare sector is vulnerable to cyber attacks for a number of reasons, including its reliance on legacy technology, a wide and highly varied attack surface that only grows more complex with the ever-increasing number of connected devices, a high-pressure environment where even the slightest delay can have a life-or-death consequence, funding constraints, and an outdated mode of thinking. Oh, tell me about it. Mm-hmm. That views cybersecurity as a secondary or tertiary concern.
Yeah. I'm like, well, that hammer, nail.
Yeah. I mean, this is the world I live in all day, every day. Having to
talk about it,
bang my head on the desk going, why are people not paying closer attention?
Well, and again, it's that secondary or tertiary kind of really, it really should move up. And that's where we've been trying all these things where, let's don't talk about HIPAA. Let's talk about business risk management.
Mm-hmm.
Just to have a different conversation. But they do go on. They continue further down. You want to hit that other section there for us?
Sure.
Or you want me to do it?
I can take care of that. So to further this, they also say, although these cybersecurity vulnerabilities certainly leave healthcare organizations exposed to patient data theft, they often have far-reaching and more serious impacts beyond privacy concerns. Cyber attacks can be detrimental to patient safety, as they can lock physicians out of treatment tools, they can shut down hospital equipment used for care, and create backlogs that delay appointments and treatment. When it comes to cyber attacks affecting patient care, the question is no longer a matter of if or when, but how often and how catastrophic the consequences.
I'm glad you did that one. After I was reading it, I knew I would never get it out. I get all tongue-tied.
So I like the fact that it's, we've moved beyond it's not a matter of if, but when. Now it's how often and how bad is it going to be?
Yeah, we're already past.
Yeah. So if you're still asking the question of if or when, you're yesterday, man. You're so 20 minutes ago.
Well, that's the thing is everybody's like, well, can you prove it impacts it? What? No. Here's the thing is, if you listen to any of our episodes that take you through what happened in an attack and the impact of, okay, confidentiality is one thing. It addresses that. And most people worry about that. And that's a lot more of a one-off or identity theft. But integrity and availability are the pieces that everyone overlooks.
Mm-hmm.
If I can't trust that the records are correct, then can I use them to save someone's life or make sure that I am saving their life and not making it worse? That's the integrity piece. And the availability. Oh yeah, well, we'll just go to paper. We'll go to our, switch over to the cloud version or whatever, but you're still not 100% fully functional. And you are building a backlog.
Mm-hmm.
And your resources are diverted. There's just so much more that people don't get. But yeah, the other critical infrastructures, they got problem. We need to worry about some water stuff. We have seen that. We need to worry about power, all these others.
Mm-hmm.
But this industry is so much more broad than any of the other critical infrastructure industries. There's so many moving parts to make it work.
Yeah. I just want people to get beyond even though we suck less than the other person.
Preach it.
Oh my
Hallelujah.
gosh.
I've actually had people say, well, we know we're better than the other guys.
Okay.
The criminals don't care.
That doesn't make me feel good. We know we're awful, but we're better than the other awful.
Yeah. We're not as bad as other people are, so you should just let it be.
Yeah. I mean, you're right. It'd be different if it was, we understand that we're not as bad as the other person, but we're working toward better, rather than them saying, we're not as bad as the other people, leave us alone.
I know. It's kind of like saying, okay, no, your doctor didn't wash their hands before the surgery, but they do it more often than the other guy would have.
Yeah. It's the whole we suck less.
Yeah.
That's all it is.
Yeah. That's, kind of like you go out and cheer for your team. We suck less than you do.
Yeah. Yeah. Oh, there's a lot to that. But I wish people would get to that point where they just see that's a problem. That type of mentality in and of itself is a problem.
Yeah. And there's a lot of it. We have those conversations frequently of, am I doing, I think I'm doing enough because I'm better than the other guy.
Mm-hmm.
Okay. Yes. We have said that over and over and over. You don't have to be perfect. You just have to be better than the other guy. What you don't know is there are plenty of other people better than you.
Yeah.
You're comparing yourself to one that's worse. Who's comparing themselves to you?
Yeah. It's always like, you know how they do which state's the best state to live in? The person that's 49th is always like, well, at least we weren't last.
I know, right? But it's the same old. And, when we say that we're talking about patient care and patient safety, we really mean it. And it's not just those things that most people think about first off. Oh, the insulin pump example or any of these others. People can't get in to have their cancer care. They are unable to get medications. They're unable to get an appointment to find out the results of a lab report.
Mm-hmm.
These things matter. And it creates undue stress for the patient, which also only exacerbates any kind of health problems. So there's a lot to it. And they did, even in the paper, 4 or 5D group were brought up. They do mention we exist. And I should probably send this when we were discussing what it is, our mission statement. This seems like it's just as good as anything we could come up with. But it does say that we bring together healthcare, industry, and federal government to raise awareness and develop best practices for providers that can be implemented by healthcare providers.
Yeah.
And that is what we do.
Mm-hmm. With some help, maybe.
Yeah. A lot. We do. We do really appreciate the HHS folks reminding us to show up.
Yeah.
Often I'd be like, oh, I totally forgot about that. So there's 3 chapters, and each of those chapters have multiple policies that they are discussing and want feedback on. And we have cherry picked out some to discuss.
Yep.
And anyone that wants to know the rhyme and reason behind our choices, good luck.
Because it's our show, fool.
We don't even know how we make decisions sometimes. We just take it and go.
Yeah, it's the old dartboard effect.
Yeah. Yeah, it is.
All right. So number 1 on our list, establishing minimum cyber hygiene practices for healthcare organizations.
So there was a long discussion about minimum standards in the working group meeting or the 405D meeting. And that's really, really hard to do because you're concerned that if I set minimum standards, then I'm doing that. That's enough. Which gets back to HIPAA is the floor.
Mm-hmm.
If that's all you're doing, you're in trouble. And that was a big part of the discussion of what does minimums really, how does it help us? Because again, it goes back to I'm better than the other guy. I'm doing the minimum.
Mm-hmm.
But cyber hygiene, we really believe is something to work further using that concept in healthcare, to get across to clinicians, things like when you reuse your password over and over, it's kind of like you use the same gloves on every surgery.
Yeah.
Without ever washing or changing them.
I'm going to start telling people it's like reusing toilet paper.
Oh, I can't go along with that one. I'm out. That's gone too far.
You wouldn't reuse your toilet paper, would you? Stop reusing your passwords.
I know I have one group that said they tried to do that in their big discussion, that they tried to do the, you change your underwear, change your password kind of thing. And that got shot down by HR. Let's don't talk about people's underwear.
Yeah, well,
maybe you talk about toothbrushes. Oh, we can't do. There you go. Same
but
thing.
all those things, it depends. Like some people
really,
don't
and then you
change
bring
them
up
near
depends. Like you're saying, okay.
All right.
Okay, back to cyber hygiene. The questions that they're asking here about that is, how would we go about creating minimum cyber hygiene, and what should be the incentives or penalties for compliance or non-compliance? And then the second part is regarding, and this one I found most interesting in a lot of the discussions. We hit it in many, many ways. Don't even take this and go, yeah, they're going to do this. No, this is a throw everything at the wall kind of stuff. But we came at this came up multiple ways, which is tying your Medicare, Medicaid payments to cybersecurity. Not in a negative way, but in a positive way. And what this part was asking is that the facilities, the Medicare conditions of participation, you have to meet certain requirements. And why not add some cybersecurity requirements? Because other patient safety risks are in there that you have to do.
Yeah.
And, or we do the critical patient safety protections. Why not include some of these?
I like it.
So then it requires the minimum standards for, in that area. So, there's something to be said for it.
Well, I mean, the penalties are there they somewhat hit people in the pocketbook. Incentives have to do the same thing in reverse order. And there are some incentives there, like when we talk about 405D and things like that. But those incentives are maybes. Like, if you have an audit or an investigation, then the incentive, then the incentive kicks in. But how can we just have an incentive across the board? Like, if you do this, you will get an incentive. Not if you do this, you'll get an incentive if the planets align.
Well, and that's really a lot of the discussion is if you can prove you're doing these minimum cyber hygiene standards and you're consistently proving you're doing those,
Mm-hmm.
then you should get rewarded for that.
Yeah. I mean, I'd love to see insurance companies give like credits or something like that, because then you can point to this and say, not only is this going to protect you, but there's a financial benefit. There's a definite financial benefit to doing it.
Well, and I mean, but there's a lot that they have done with those, encouraging people. If you're not on an EHR, your payment rates go down, your scale or whatever. They give more payments based on where you're located, but they still encourage things in rural areas. So there's a lot of things that they do that are directly related to get paid more. And there's another section that talks about that in just a minute. So, but there's a lot of areas there that I think, I mean, every time you turn around, at least as a group, there were many, many discussions of how can we pay you more if you do this?
Dude, you know how much I would love to go out and say, let me help you with your cybersecurity program so you can get paid more? I mean, that would be fantastic.
Yeah, and we're going to hit that in just a second about how maybe we can do that. But what do you think about the next one, though, David? You give me
Yeah, I don't know. So should providers have a quote unquote right to repair medical equipment by contracting with third party providers? I mean, yeah, I think so to some degree.
Yeah, as long as there's qualified third party providers.
Yeah.
It's kind of like, yeah, right now I can get my IT done by, I got a guy who comes, every third Wednesday.
Mm-hmm.
That's not who I want repairing this medical equipment.
Yeah.
I want to know for sure they know what they're doing. But after that, yeah, I don't see why not. I know there's plenty of companies out there that do know how to do it.
Yeah, that's one of those fact-specific determinations, because I know, and I'm not dealing with medical equipment, but I'm dealing with computers most often, and people are always fighting to keep them going.
Yep.
To a point where it drives me insane. Like, you're going to spend more money to keep this dinosaur running than you can just buy a new one.
I know.
I mean, we've even got to the point now in the IT world where if you want to use an old computer, we can't necessarily force you to not do it, but we're going to charge you more money to support it. We're basically punishing them using these old computers and say, look, if you would just upgrade, your price would go down for support and things like that. Because for whatever reason, people are like, well, it still works. It's 10 years old. Look. But yeah, I mean, so when you look at that, do you have a right to repair? It's one of those things that can definitely harm the company more than it helps the company by giving them that ability. Yeah.
Which then dovetails perfectly into the second question, which I think has better, I wouldn't say more, but better protection for everybody. Should medical equipment manufacturers be required to update their products for a certain length of time?
Mm-hmm.
That we see, and that we know. We see that with Windows 10. We know when that's going to go away.
Yeah.
But they don't give it to us for just 2 years. I mean, we've been using Windows 10 for a long time.
Mm-hmm.
And having a set amount of time that you have to do it on these kind of devices, to me, is not a bad idea. But I also know how tricky that can be. But those things are expensive, and we need to be able to maintain them long term instead of just saying, yep, we don't provide support for that anymore.
Yeah. Well, I think one of the problems, at least I see this in the smaller practices, is that there is no consideration for replacing, whether it's EHR software or hardware. There's no consideration until it needs to be replaced. And then it's a mad scramble trying to figure out how you're going to do it.
Yeah, go into panic mode is the plan.
Yep.
Which goes back to, we need to plan for everything to be a legacy.
Yeah. I mean, when I sell a computer to a medical client, actually any client, but I sit down and go, okay, I just sold you this brand new computer. Here's the time frame in which we need to be talking about replacing this thing.
Yeah.
Of course. And I always have people look at me like, I just bought it. And you're talking about replacing it already. I'm like, no, I'm talking about a plan to replace it. When should we start thinking about this? But I mean, go ahead and do it from the beginning. You know, as you pointed out with computers, you know that it's not going to be good at certain date. So go ahead and plan for its obsolescence.
Yeah, even my own desktop computer that needs to be replaced. And but it's not a lack of desire or any of that stuff. It's just me getting around to doing because I support myself. But anyway, yes, it's the thing, and those are a major problem, legacy devices. And again, a big problem that happens in this industry that's scattered everywhere these things are. We're not talking about they're only in the hospitals. So it's a much bigger picture than what most people outside the industry would be able to see. I've had so many people that have been in financials, and I've had conversations with them. I've run, this and I've run that. And then I figured I could just get into healthcare to be the same. Oh, no.
Yeah.
There is no other sector that operates under these conditions. And it's not like you could just move it. That would kind of like we could save the Titanic if we could move, healthcare. It's just so big, which is a great segue into the next one, which is another one in chapter 2, financial implications for increased cybersecurity requirements.
It's the cost of doing business.
Well, and they make that point right away. And this one I did put in there what their discussion was about it, because I thought it was quite good. The way it was brought up is cybersecurity should be cost of doing business. But given the Medicare program's outsized role in setting the standards for healthcare payments, not just Medicare's, but everybody's kind of based off what Medicare pays. It's necessary to determine how those literal costs of doing cybersecurity business are reflected in payment formulas the way paying the electricity or water bills are. Because they calculate what they think the overhead cost for doing X thing is, but it's a good point. My guess is they're not calculating real cybersecurity requirements and the increased threats and all of those things in those payment calculations. Further, some settings, such as independent providers or those in rural settings, may need assistance in, quote, startup cost in technology and workforce talent. And really, go ahead.
No, I could just completely agree with that. They definitely need it. I can't tell you how many times I have a new provider call me and they're like, I'm just starting my practice up. What do I need? And we have that conversation. And more times than not, they're like, I'm just starting. I can't do this. I can't afford these things. I'm just starting out. So where can I start? And there's not necessarily like, hey, let's have a 12-step program to get you where you need to be. You kind of have to jump in and take a big chunk of it at first. It's like, I can't just barely protect you. I'm either going to protect you or I'm not. I can't barely protect you.
It's like, you jump in and learn how to swim. You've got to.
Yeah.
You got to find something that helps you swim. You don't have to be Michael Phelps, but you're going to need to swim.
Yeah. The bigger, but another problem is they don't understand the complexity of what they're dealing with.
Right.
And so because it's cyber, it's also invisible. And so what is it? What did they say? Out of sight, out of mind?
Yeah.
And they go, hey, I've not had it for 6 months and I've been in business and nothing's happened. So I don't know if there's any real value in paying you for this stuff that you say I need.
Yeah.
Anyway.
Well, and the other point here, the startup cost is not just brand new businesses, is I feel pretty certain they mean those who needed to do it and have never been able to invest the money or never chosen to invest the money.
Yeah.
They are just starting up their programs, not maintaining them.
Never chosen would be a good one. I mean, maybe I'm wrong here when I say this, but as far as I can remember, I have yet to run across a prospect or client that when I said, what is your cybersecurity budget, that they actually had an answer other than, I ain't got one.
So it's quite telling. And that's exactly really what are the financial implications? Because right now, the only financial implications happen when it goes wrong.
Oh, yeah.
That's what everybody worries about.
But they can find all the money in the world when things go wrong.
Quickly.
Yeah,
Quickly.
No.
So the two questions we're going to focus, I think there's some others in here, but we were looking at two of them. How should Medicare payment policies be changed to ensure cybersecurity expenses are incorporated into practice expenses and other formulas the same way other basic expenses are? And I think that one's huge.
Yep. I don't have an answer for you, but I think it's a great idea.
Yeah. This is not our area of expertise. However, we are glad you are asking that question.
Mm-hmm.
And then for startup grants, what should be the eligibility criteria for a grant program that provides small, rural, and independent providers with funding for cybersecurity? And who should administer such grant program? What should be allowable uses of such funds?
Again, great idea.
Yeah, now we could answer some of those things.
Mm-hmm.
We're not going to choose to do that right now.
Well, the allowable uses, I think's an easy one. But anyway, we'll move on.
And the eligibility thing is, okay, yeah, you chose not to invest in cybersecurity, but you got a big fancy building with all the latest everything else and didn't do cybersecurity. I'm not feeling that. You should get a grant. So anyway, but chapter 3 focuses specifically on the ability to recover after an attack. And we talk about the University of Vermont medical system and their attack a lot, but it's because they've been very good in sharing what they learned. And it does feature, and I just did a little screen grab of it to put it in the show notes, that section, but it gives you the big boxes to get your attention. 28 days, their system was offline.
Wow.
And everybody says, well, that's the big guys. No, they're saying now they're finding averages not far off from that.
Yeah. I mean, they may be the big guys, but they also have more resources. So it's all going to equal out the same.
And the infection spread so quickly. I mean, it was like they saw it happening and trying to stop it. 1,300 servers and 5,000 additional devices were infected with malware. So even if you weren't part of that medical center, but you were associated with it as an independent practice, it's going to have a huge impact on you. What's your plan? Right? What's
What's
plan?
in your wallet?
I mean, this is the reason they brought in, they had to activate the Vermont National Guard to help rebuild devices.
Wow.
And it was 800 applications were involved. And that goes back to when we ask you what software you use, we want to know what all of it is that you use. And then I did include the little paragraph under here, while UVM successfully switched to, quote, the downtime procedures, which everybody, we go to the paper, we'll do this, that they had practice, which we always, so they had done the right things. They soon realized how insufficient it was as the drill prepared providers for a scenario in which systems were unavailable for only 12 hours.
Yeah.
Staff also learned that other non-tech issues, such as newer medical staff without experience with charting and writing paper orders quickly, did impact them.
Mm-hmm.
So, and I love asking that question, in a big, conference setting, and you're speaking with a lot of variable groups and sizes, and you say, how many of you, your plan is to go to paper? All the hands come up, or when they know me, no one wants to put their hands up. But then I'm like, how many people on your staff have never done their work using only paper?
Everybody.
You hear crickets, man. Everybody's like, holy crap, hadn't even thought of that. And it's a big piece that so many say, well, this is my plan. Well, let me just tell you, you better think through that plan a little bit more, because there's a lot of pieces that are involved. I mean, you got to understand the cost of going to paper. The more resources it requires, you got to have those resources. You got people that never knew how to do it. And then you got to get that data back into the system after you're done. Don't forget to include that in your plan. So this whole section, there are some several discussions in here, but we knew we would be running out of time.
Yeah.
Because there were too many rabbit holes. So we did select just the piece on cyber insurance, because that is one that is near and dear to our heart. We don't worry about it. Insurance will cover it.
Yeah.
Yeah, you're the reason we are where we are. And there is a bigger and bigger thing. And I think I mentioned it on the last episode where I was talking with a broker who said the quote was for a practice was like $8,000 a year. And then when they did their application, they said they didn't do MFA, just that one thing. We don't do MFA. Shot their quote to $23,000 a year.
Golly.
Right. So,
Yeah.
It's something we have to worry about. So there's a lot of discussion in this whole section, and I strongly encourage anybody that's remotely interested in this, even if you don't want to give your opinions, use these to ask the questions to leadership or to your peers or for discussion to look at a bigger picture. And so, number one, should Congress create a reinsurance program or otherwise regulate cyber insurance? I can pretty much tell you the cyber insurance people have been bleeding money.
Yeah.
And that's not what they're in business for.
No.
What can Congress do to facilitate information sharing between the intelligence community and insurers? Now, I thought this was pretty interesting, because the insurance folks, claims are being opened. They're learning about it, even when the intelligence community isn't being told about it.
That's true.
Because nobody wants to tell.
That'd be interesting. So maybe they'll come up with a law that says insurers have to report.
Well, let insurance companies be the ones that report anonymous information about the businesses and what they're seeing. I think that would solve a lot of problems.
Yeah, it would.
But again, now that's another rabbit hole. And then I really like what's the role of cyber insurance in ensuring care provided via medical equipment that has been recalled or currently unpatched? I've seen that asked before. I can't use this anymore because of it's no longer cyber secure, but otherwise it works fine. So should cyber coverage allow them to have, some sort of coverage to replace those devices?
I don't know.
I know. That one's a tricky one, but I thought it was interesting.
Yeah.
So there you have it, David. Those are the ones we're going to talk about, but there was a bunch more.
Yeah. Well, if nothing else, there's a lot of really great questions here to get you to thinking.
And then you just sit there going, good question.
Yeah, good question. Don't have an answer for you, but great question. No, but I mean, just the fact they're asking these questions is great.
I agree. And really thrilled to see the discussion at least being out there. And again, encourage folks we'll have the link, but you can search for the title of, cybersecurity is patient safety. Everybody's talking about it. Mark Warner, cybersecurity is patient safety, something like that. You'll find it, or you could easily go to the Help Me with HIPAA website. Today's show notes for episode 382.
He'll be there.
And it'll be there.
All right, folks. That is our show for today. Thanks for listening. Be sure to share us out. Call up Senator Mark Warner and say, hey, we talked about you.
That's right. They're awesome.
Yeah, there you go. And even though we always say that HIPAA is not about compliance, it's about patient care, apparently cybersecurity isn't about compliance. It's about patient safety.
There you go. Same thing.
Yeah.
We're always ahead of the curve, David.
I know. So there you go. Whether it's HIPAA or whether it's cybersecurity, it's all about the patients. Just remember that.
Mm-hmm.
All right, folks. Catch you next week.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.